Hi everyone, welcome back to my YouTube channel. Today we are going to talk about maxilla, and here at the side you can see the diagrammatic representation of skull showing the highlighted part, that is maxilla. So let's start our topic with introduction. Maxilla is a paired facial bone that fuses at the midline to the upper jaw. It plays a central role in forming the upper dental arch, anterior hard palate, floor and walls of nasal cavity, and floor of orbit. Together, the maxilla contributes significantly to the contours of face, especially around the cheeks, nose, and mouth. It has following parts: body of maxilla, that is the largest portion, that is roughly pyramidal in shape, and then it has surfaces that are anterior surface that face the face, with the infraorbital foramen, that is opening for the infraorbital nerve and vessels. Then it has orbital surface that forms part of orbital floor, and then it has nasal surface that contribute to the lateral wall of nasal cavity. Then it has infratemporal surface that forms part of infratemporal fossa. It contains the maxillary sinus, that is the largest of paranasal sinuses. Further talking about its main part, it has four processes. They include frontal process that is sent to articulate with the frontal bone, as you can see here in the diagram. It has zygomatic process that extend laterally to connect with the zygomatic bone. It has alveolar process that houses the upper teeth through the socket, and palatine process that project horizontally to form the anterior three quarters of the hard palate. Now let's talk about important openings of maxilla. It includes infraorbital foramen that transmit the infraorbital nerve, that is branch of trigeminal nerve. It has incisive foramen that is located behind the upper incisor passage for nasopalatine nerve and sphenopalatine vessels. Then it has maxillary sinus ostium that allow drainage of the sinus into the nasal cavity. Now let's talk about articulation of the maxillary bone. Each maxilla articulates with the 9 bones. They include cranial bone, that is frontal bone, the facial bone that includes zygomatic bone, nasal bone, lacrimal bone, palatine bone, inferior nasal conchi, vomer, ethmoid bone, and the opposite maxilla. Now let's talk about function of maxilla. First is it supports the upper teeth and oral cavity. Second, it forms the nasal floor and lateral wall. Third, it shapes the eye socket, houses the maxillary sinus which help lighten the skull and humidify inhaled air. It provides passage for several major blood vessels and nerves. Now let's talk about clinical significance of maxilla. First is cleft lip or cleft palate. That results from incomplete fusion of the palatine process or upper lip. Second, sinusitis. That is infection of maxillary sinus. It can cause facial pressure, tooth pain, and nasal congestion. Third is lip fold fracture. That is classification of midfacial fractures, often involving the maxilla, that is important in trauma care and maxillofacial surgery. Fourth is dental procedure, as maxillary anatomy is crucial for extraction, implants, and nerve blocks. Now let's talk about conclusion of this lecture video. Maxilla is more than just your upper jaw. It's foundational anchors that unite your facial skeleton, influence your voice and appearance, and protect vital structures. It is structurally critical and is aesthetically defining. And this was all about maxilla. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.